My parents are great. My dad was an awesome dad, but there weren't ever really any conversations about what it is to be a man and how a man should show up. And so I learned what it was like to be a man from society, from the things that we saw at a young age, some good, some bad, examples that people were setting. And I think in today's society, especially now with social media, the example of a man is get rich, get powerful, get the women. And I will say that, as my life wore on, I achieved all those things and I felt completely empty. I heard somebody say there's no despair like the despair of chasing after something your whole life and then getting it and realizing that you're completely empty and unhappy. And so that's where I was when I went to Ruck. I was like, I just don't know, what am I here for? Why am I here? I've achieved all these things that society has told me that I need to achieve, and yet I'm miserable.
All right, everybody, welcome back to another episode of the Big Hitters Podcast. I'm joined by my friend George Loukatos, who's a buddy of mine from Rise Up Kings. You're probably starting to notice a trend. A lot of people that come on the show are buddies of mine from Rise Up Kings. And George has a pretty cool business. He has a number of urgent cares. And so he's the founder and president of AlphaCare. He is a general all-around stud. And I'm excited to dive into it with him today. George, just tell us how you got into the space. How did you wind up owning a handful of urgent cares?
Yeah. Well, to start way back, I'm the product of the American dream. My parents came here with a suitcase each, and as Greek immigrants, I think the dream was always for their son to be a lawyer or a doctor or an accountant. I think those are the three things that immigrants are like, oh, there's stability there. So ended up going to med school, and practiced emergency medicine for about 18, 19 years. And, that's a young man's game. Um, Late nights, night shifts, holidays, every other Christmas, every other New Year's. And so, as you get older, working every other Christmas is not fun when you have little kids. And so I kind of started trying to figure out what can I do to make my lifestyle a little bit better. And I was the director of my emergency room as well as a regional director for several others. And I'm like, if I can run a bunch of emergency rooms, I can surely run a bunch of urgent cares, which are kind of just dumbed down ERs. So I opened my first urgent care right before Christmas of 2018, and had just opened my second one about a year later, and COVID hit, and that was a rainmaker for I think all urgent cares. It just once the initial lockdown was very scary. We went from seeing a lot of patients to zero, and then as soon as testing came about, it was like we couldn't handle the volume of patients coming in to be seen. So we learned a lot during COVID, a lot of ways to refine our processes, and during COVID, we opened our third location, and we've just kind of been growing steadily ever since. We've been kind of averaging one location per year, and we've been very blessed. So, have great employees and feel like a good model. And so we'll see. We're going to continue to expand and see where this takes us.
I guess I've just never thought about urgent cares. I mean, I've been to some. We have three kids. My youngest Sam is two, and in a series of 6 months, broke his femur, split his lip, split his eyebrow. So we've single-handedly kept emergency rooms open in
Hmm.
Colorado. But I always just thought urgent cares were run by like hospital networks. So
Hmm.
they're are they typically privately owned, like yours, or is that your competition typically, or?
That's part of the competition. So I think there's three kind of main models. I'm probably in the minority of privately owned. The other two models are hospital networks, and they basically open urgent cares to feed their emergency rooms and their ancillary services, their imaging centers. They want hospitals make their money off of facility fees from surgeries and ancillary services like imaging, MRIs, CAT scans, that type of stuff. That's where the money is for the hospitals. So they like having urgent cares because it feeds their system. And then the other main type of structure that you'll see is private equity backed larger chain type models where they will go in, they'll find a smaller chain and say, okay, we're going to back you, go out and put one of these on every corner in America. So they tend to be regional right now. The big ones down here, there's a couple of them. I'm not going to give them any free plugs, but those are our main competitors. So the days of a private doctor owning his own practice are limited, I think, and that's one of the challenges we have in our business. I just don't know how sustainable this is long term,
Mm,
because big hospital networks get deep discounts, whether it's from medical suppliers or they have more negotiating powers with insurance companies, so they can negotiate better rates. Whereas small guys like us, we're basically at the mercy of, we'll give you what the insurance companies tell us, we'll give you what we're going to give you, and you'll be happy with it. So healthcare is a unique industry. It's really the only industry in America that I'm aware of where we don't, supply and demand doesn't dictate rates. Insurance
yeah.
companies dictate rates. And it's
Mm,
kind of messed up. And I think everybody's feeling that squeeze, whether it's the providers or the consumer. People's insurance deductibles and premiums are going through the roof. They're paying more and more for their premiums, and yet, you know, their services are getting more and more limited. It's harder and harder to
yeah.
find people that will actually take your insurance.
Yeah. Random thought, but I somehow got targeted by these algorithms of these influencers that show you everything in your house that's basically killing you. And I have to imagine that, and I'm just curious to hear about like what types of things that you normally see and treat. But
Yeah.
yeah, the whole healthcare system in our country is all jacked up. What was the short statement? It's like we're the only one in, one of the only countries where it's like doctors get paid more the sicker you are, kind of, or like
Hmm.
they're not really incentivized to solve problems, you know?
Right. Yeah.
Yeah.
The hospital, the system itself is more of a treat rather than prevention. They're moving. They're trying to incentivize prevention, but the problem with prevention is patient compliance. And
Yep.
when you go to the grocery store and everything is processed and is trying to kill you, then compliance is difficult, especially for those who can't afford. I feel like the healthier you eat, the more expensive it is in this country.
Yeah.
It's and so I saw something the other day. They said the average weight of a woman on food stamps is 210 pounds, and it's not because they're overeating; they're just eating crap because that's what's cheap and what they can
Yeah.
afford.
Yeah.
So,
Yeah, I became randomly an expert in things like sleep apnea and like very common things because I used to do a lot of life insurance production. And some of the things I
mm,
had to squeak by underwriters was like I had to go to bat for clients with just pretty common stuff, but I saw it a lot. Like sleep apnea, I saw a lot. Diabetes, a
mm-hmm.
ton, you know. Um,
Yeah.
Not to mention the occasional, smoke of a cigar or Zyn or whatever. Those
Mm,
those seemed easy and paled in comparison to how much I saw sleep apnea, you know.
yeah.
Um,
Yeah.
so so what are some?
Obesity
I
is a
want
big
to
problem.
totally, yeah. Okay, random tangent. What are some of the gnarliest things you guys have had to treat in your urgent
Oh
cares?
gosh. You want ER stories or urgent care stories? The ER stories are much
Either
better,
one, man.
but
Yeah, yeah. Tell me an ER story.
um gosh, I don't know. This is a lot of them are probably not suitable for this podcast, but I don't know. I've been asked like what was the thing that finally drove me out of the ER, and I think people don't realize how violent ERs are. Our
Mm,
facility, our hospital was associated with a psychiatric facility, so we'd get a lot of mentally ill patients who would get extremely aggressive at times. Um, and so it would kind of fall to the able-bodied men of the staff to kind of subdue people when they were going berserk. And remember one time, this patient, we used to kind of house everybody towards the back of the ER, and they would stay there for days because unfortunately psychiatric services are very limited across the nation. So finding a psych bed for a patient is sometimes difficult. So sometimes they'd hang out with us for days, and they would of course get agitated because they didn't want to be there any more than anybody else. So we had this guy, man. He came out and got a hold of the dustpan off the housekeeping cart, like the big, the big industrial dustpan that you put on the floor, and started swinging it around into the walls, swinging at the nurses, and so we had to kind of wait. And when the opportunity arose to tackle him, and Um, I remember after we got up, the nurse said to me, "Are you okay?" And I'm like, "Yeah, why?" And she's like, "You went down hard, like on your hip, like almost like it just, and those linoleum floors." And I went back to my desk and I was like, "Man, my hip is killing me." I was like, "Man,
Dang.
I'm just getting too old for this stuff." So that was kind of when I was like, I gotta look for a more civilized work environment. Like I said, it's a young man's game, but I had a buddy that was working at a sister facility that a psych patient jumped on his back and stabbed him 7 times in the back.
Ugh.
Thankfully all superficial, and he went to the OR and just had to get cleaned out more than anything. But those ERs are kind of crazy places. You've got people constantly trying to die, and then on top of that you've got a line of people out the door who have less emergent things. And a lot of people don't understand that it's a triage process. And
Yeah.
we did everything we could to kind of maximize the efficiency, but as everybody has probably heard, there's a big nursing shortage in this country too. So sometimes you'd have a 30-bed ER and you'd only have 4 nurses to run it. So things would back up, and everybody would just get agitated, and it just not a pleasant environment for anyone. So
Yeah.
those things wear on you, and like I said, it was time to look for a new place. But the gnarly stories, like I said, most of them are not suitable. We've seen some disgusting stuff, but probably not suitable for this podcast.
George,
Yeah.
let's talk business again. What's going really well with your business, and what do you feel like your is it either a barrier you're trying to overcome, or a problem you're trying to
Mhm.
solve?
Yeah. So I think the thing that's going really well is we have a really good product. I think because of my experience in the ER, I was able to kind of take that experience and flip it on its head. So we really focus on efficiency, comfort, friendliness, everything that doesn't exist when you go to the ER. So we've been able to leverage technology to allow people to kind of get in line from home. So you get on our website and you can, rather than waiting in the waiting room, you just get in our line, and then it'll text you when you're second in line so you can head to the clinic. We also allow people to schedule appointments. We found that going back and looking through our Google reviews, we've got thousands of them now, and really the only common trend towards any negative reviews was the wait time. I had an appointment and I still had to wait an hour, or I had to wait 2 hours. And so we've really focused on trying to respect people's time and create a system where we can get people in and out. And even if it's going to be several hours before we can see you, at least you can wait at home or go run your errands or do
Mm,
it. So I feel like today, with the technology available to us, there's no reason why anyone should sit in a waiting room for 2 hours. Um, so I think that's probably the best thing is our product. I have a very strong faith in our product, and just the basis of it is just be nice to people, treat people well. Our kind of unwritten motto is just do what's right for the patient, and everything else will fall into place. And we've really found that to be true.
yeah.
Um, the biggest challenge is definitely insurance. Like I said, it's getting harder and harder to make ends meet. For example, in 2025, I'm sorry, 2024, with that huge inflation that we saw between 23 and 24, our supply costs for some of our things tripled, like simple shots and stuff like that. Labor costs went up, everything went up, and yet CMS cut reimbursement to physicians 3.2%. So we saw inflation rates of sometimes 30, 40, 50% all in, and then yet they were cutting our reimbursement. So that's the biggest challenge right now. And I do think that something's got to give with the insurance company and the insurance industry. Like I said, patients are paying higher and higher premiums. Doctors are having a harder and harder time keeping their practices open. And, insurance companies are printing money and sponsoring college bowl games, and, just it's like raining money for the insurance companies. And unfortunately,
Mm,
they've been allowed to kind of do what they want. So,
mm,
but that's our biggest challenge for sure.
yeah. Let's talk about AI for a second.
Mhm.
How is it affecting your industry, and how are you leveraging it?
Ooh, a lot of ways. I don't think a day passes that I don't use AI. Whether it's just recording meetings, helping put together SOPs, putting together job descriptions, all that kind of stuff within the business. We are utilizing it with, we're trying to combat the insurance companies because the insurance companies are using AI to deny claims. So we're using it
Mm,
on our end to try and rework claims. So there's certain, diagnosis codes or certain things that the insurance companies like to flag as for automatic refusal. So, um, our partners are leveraging AI to kind of help us manage denials. So, it's definitely the future. I don't know that it's necessarily going to replace a lot of people. We've had proposals for like AI driven front desk, like basically someone answering the phone. We haven't gone in that direction yet. I still think there's value in our industry. We definitely need, a human being there, saying, greeting people with a smile and navigating through things. Um, but you know, and I'll tell you, it helps me with my continuing medical education too. It's a lot
yeah.
easier now to, if I have a topic that I need to look up. Um, we used to have this program called Up to Date. I don't know how long those guys are going to be around anymore because it was literally
Mm,
it was a portal that you could get in and it would give you all the most up to date information from each journal on whatever topic. I feel like ChatGPT has pretty much replaced that. I can get on ChatGPT and put in anything and say, give me references. Make sure that the information you're drawing from is within the last 5 years. And it's pretty incredible what it can do in the medical field.
mm, that's powerful.
Yeah.
What's one area of your business you feel like you could be leveraging AI, but you're not?
I would love to use it to read X-rays. Actually, our radiologists are doing that, but I would love it if we had our own thing and we could just kind of, I hate to say this, but cut the radiologists out. Um, I can tell a lot of our reports are AR generated, and I think right now the standard in medicine is that I think AI is reading a lot of your X-rays that you have done. Like if you have a wrist fracture, and then the radiologist is supposed to overread it. But I wonder if a lot of these services are even having that overread. Um,
Mm,
what they've done is you can take thousands and thousands of images of a normal wrist and thousands of images of broken wrists and teach AI how to detect the slightest little fracture. Something that a lot of times the human eye would miss. So I think that those services are going to become available to just the regular old physician to kind of help support our practices and make us more efficient.
I love that. Um, yeah, my neighbor, he works from his house and he basically reads scans all day. And he's like, the fact that I have not been replaced by AI yet, it's clear to me that it's coming because
Hmm.
literally it's the same thing over and over and over again.
Yeah,
So, and he
yeah,
occasionally has to go into a clinic and like show his face, but for the most part, he just reads scans and he gives
yeah.
his report. And he's like,
Hmm.
yeah, there's for sure an AI coming for me. So
Yeah, yeah. It would be scary. There's certain parts of medicine, certain niches in medicine that I would be very worried about my career longevity with AI. Radiology being definitely at the top of the list for sure.
I think it's interesting to me as I look out at the scope of different industries, it's replacing low level work, like the role you would hire like a junior analyst for, or a
Hmm.
paralegal, in the legal industry. And so I do think that those days are getting replaced by AI. And I saw a quote the other day I thought was so powerful. It's like if you're creative, you're not getting replaced because that's the one thing that AI cannot replace is creativity. And I just
Right.
thought that was a really powerful, concept. So,
Yeah, absolutely. I've seen
um,
the same quote.
yeah.
Yeah. Which for
Uh,
analytical guys like me is not good news.
mhm. Well, but you're creative. You started your own businesses, right? And so at the end of the day, I agree with you. I think as AI takes over, people are going to crave a human touch. Like there will eventually be buttons that you can click on social media and say, I don't want to see anything AI. I only want to see the real
Yeah,
stuff. And
Yeah.
so if you focus on the client experience and being better at what you do, and then you leverage AI where you can, I don't see a world in
Yeah.
which it takes away your stuff,
Yeah.
you know?
I agree with that. We saw that a little bit with telemedicine, similar concept where, you can just basically get on the phone with the doctor and they'll, diagnose you and prescribe you what you need. But I feel very strongly that there's still power in, first of all, laying a stethoscope on someone and actually, doing a physical exam. I mean, there's only so much I can see through a camera and examine you. Um, but also in just, sitting down and, having a conversation face to face in person. So, medicine is, there's a high level of trust that people need to have in their provider. You want to know that the person treating you is listening and doing, like I said, a thorough exam on you. And
Yeah.
while you might, typical viral throat ache or a strep throat, that may be fine to treat via telemedicine, but so it goes back to, there's certain things that we got to go old school, and I think a large part of medicine is practicing that old school way.
Amen. Well, last question for you. Let's talk about Rise Up Kings for a second. So that's how you and I know each other. I always like to get a
Yeah.
little testimony for those guys because they've changed my life so much. But talk about how it's affected your life, business, family, whatever it's affected the most.
Yeah. My favorite topic. So I went through Rise Up Kings just over a year ago. I graduated October 6th of 24, and it has completely transformed me. And it's really, really hard to describe the impact it's had because, and as a 52-year-old guy now, I wonder, like, what have I been doing my whole life? Like, how did I manage to kind of skate through life in just such a blind way? And so for me, it's kind of opened my eyes to just a whole new way of life. I tell people I used to, for years, um, my family would say, "What do you want for your birthday?" And the answer was always saying, "Peace and serenity. I want peace and serenity." Like knowing that I'm not going to get it, but I was just constantly stressed out, constantly, I'm a very um, uh, task oriented and achievement focused personality. And so, what I found was that I went through Rise Up Kings and I shifted my focus to my faith. That's the only thing that's ever brought me peace in my life. And it took me
Mm,
51 years to get there. Um, you know, as men, we are trained from a very young age to achieve. And my parents are great. My dad was an awesome dad, but there weren't ever really any conversations about what it is to be a man and how a man should show up. And so I learned what it was like to be a man from society, from the things that we saw at a young age, some good, some bad, examples that people were setting. And I think in today's society, especially now with social media, the example of a man is, get rich, get powerful, get the women, you know, and I will say that, as my life wore on, I achieved all those things and I felt completely empty. I heard somebody say there's no despair like the despair of chasing after something your whole life and then getting it and realizing that you're completely empty and unhappy.
mm.
And so that's where I was when I went to Ruck. I was like, I just don't know, what am I here for? Why am I here? I've achieved all these things that society has told me that I need to achieve, and yet I'm miserable. Um, so, the process of kind of exploring your priorities and your purpose was the biggest thing for me. And just, what I've learned is it all boils down to my relationship with God. So, I'm a year plus into every morning reading the Bible. That's how I start my morning every morning. Praying. I'm now journaling my prayers now to kind of keep me focused because my mind is all over the place. So I found that like writing down my prayers helps me focus and have those conversations with God that I need to have. And honestly, now if I don't do that, if there's a day where for some reason, I'm getting up super early and getting on a flight or something, like I get thrown off of that, my whole day is just, it's not right, you know?
Yeah.
Um, so it has been truly transformational for me. It has, I think the people around me see a change in me. It's definitely made me a better leader. Um, I'm showing up in different ways for my employees, and I think it's changing them too, which
Mm.
it's funny. Skylar Lewis, the founder of Rise Up Kings, says that openly. He's like, we're not honestly trying to change you. We're trying to change everybody around you. We're trying to make an impact on everyone around you by changing. They're changing us, but really the impact is not for us. It's for those people in our communities and our families and everybody around us who, um, suffers the consequences when we don't show up in the right way.
Yeah, that's a great word. Well, George, if people want to learn more about who you are and what you do, where can they go?
Well, AlphaCare, is our website. I'm not a big social media person. That's actually one of the things that I found is kind of leads me down the wrong paths in life. So I'm not on social media much. We post for our business, and I'm on there occasionally, you know, um, but I would say go to our website, AlphaCareUrgentCare.com. You can learn about the business, and there's a link there. If you want to email me, you can get in touch with me that way.
Amen. Well, hey, don't go anywhere. I want to keep chatting, but thank you so much for coming on the show.
Thanks for having me, Andrew. It was a privilege.